Hi everyone, here's your data update for Phase 1C. The 7-day rolling average of new cases attributed to COVID-19, reported to CDC for Midwest states, appears to be surging, not only in Michigan, which we've been tracking for a few weeks, but now unfortunately spreading to Minnesota and Illinois. Here's a look at concerning Illinois hotspots that will certainly impact Chicago. And here's a look at Chicago hotspots on the north and northwest sides, as we also see the proportion of cases caused by variants of concern increasing locally. Variants are increasing across the country and will impact our local outbreak as individuals continue to travel or loosen their mitigation behaviors. So how are we doing actively preventing spread in Chicago? As of April 14th, 1 in 3, or 38% of Chicagoans, have received a first dose of vaccine. 4 in 10, or 47% of Chicagoans 18 plus, and 6 in 10, or 62% of Chicagoans 65 plus, have received a first dose of vaccine. Unfortunately, compared to national numbers, Chicago's 65 plus first dose coverage is still lagging behind, only 62% locally compared to 80% nationally. So my question today is, have you run a COVID immunization due report in iCare yet for your patient 65 plus? It's time to really get back to basics, and this can help you do targeted outreach to your patients after you've created a provider-specific patient list. Additional instructions are available through iCare training videos. You can also ask your IT experts how to run these reports in your electronic health record. As you can see here, the number of completed series is at an all-time high for the second straight week at 15,879 completed vaccinations per day. First doses continue to plateau around 17,500 to 18,000 doses a day. Vaccine equity in terms of race ethnicity has room for improvement. Percent of first doses that went to Black and Latinx Chicagoans was stable at 39% last week. But note a large increase in the percent that were administered to those of other race, 2.4% 2 weeks ago compared to 8.9% last week. Please make sure that all race ethnicity data is being obtained and recorded for all your administered doses. Geographically, the north side of the city has a much higher percentage vaccinated with first doses and completed series compared to the rest of the city, with the exception of Hyde Park and Beverly. We like to look at this measure not only cumulatively, but also in terms of trends. So you can see here that the community areas with the largest increase in first dose coverage last week were on the north side and Hyde Park. Looking just at seniors 65 plus, we see some increased equity in terms of community areas across the city, with at least one dose of vaccine improving, but completed series are still lagging on the south and west sides. In terms of the number of doses administered by provider type, I'm happy to say that hospitals, FQHCs, and outpatient providers account for 50% of the doses administered in the last week. As we work to get more vaccine into the hands of primary care providers, making yourself visible to patients becomes increasingly important. So please take time today to make yourself visible in Vaccine Finder with the instructions shown here, also available on the CDC website. This will also help patients see what vaccines you have in stock. So use the following link to find instructions on how to turn on your visibility. Updates to provider details submitted before 6 a.m. Central Time will display on the vaccinefinder.org website the same day.